We've got a panel now to discuss an aspect of our healthcare system that does not get enough attention. And that is, what does it mean when we spend $10,000 per person on healthcare? What does that mean to the business community? What does it mean for the overall economy? What does it mean for international competitiveness when we're spending so much more than other countries that guarantee health care to all people? And we've got a great panel to discuss some of these issues. Let's start with Richard Master. Richard is the founder and CEO of MCS Industries in Eastern Pennsylvania. And this is a company which does about $200 million a year in business. And for a number of years now, he has been very active in the fight for single payer. Richard, you're a business guy. Why is single payer sensible to you and to the business community?
Senator, about 5 years ago, after many, many years, 10 years of volatility in cost and demands from insurance companies annually for increase in premiums, I realized that this was something that I had to get involved in as a patriotic American. Our company employs 180 people in Pennsylvania and throughout the United States. Our health care bill is $2.8 million a year. It cost $27,000 to insure an employee with a family. That's $13 an hour, $13.50 an hour, which is, if you put this into context, it is about as much as 1/3 of the population can't make in a year. So this is an outrageous cost. We're beyond the tipping point at this point. We have really got to do something to control costs. Now, we look at the Medicare for All solution. Right now, we are spending about 18% of payroll for health care costs, for health insurance. We look at Medicare, the model for Medicare for All, it's 10%. We could be saving tremendous amounts of money, and we would be relieving our employees of the anxiety of maybe not being able to pay their deductibles and copays.
As an employer of a couple of hundred people, how many people do you have?
180.
180 people. What would it mean to you to know that every one of your employees had good quality health care, and it's not an issue that you have to spend half your life worrying about it?
It would mean so much to the spirit of our organization. We're a caring company. We provide scholarships for our employees to go to the community college and other colleges and to their children. And we see day after day employees that are threatened with bankruptcy. Now, what we have done, we've had insurance policies, and then we have a secondary insurance policy that takes care of the deductible so that our employees don't have that anxiety. But that's the reason for the massive expense. The $27,000 a year, that's approximately the average cost across the country for a family of 4 in this country.
Are you finding more and more people in the business community going beyond ideology and understanding that Medicare for All would be a good policy for them from a business perspective?
Yes, we're seeing that. We started an organization called the Business Initiative for Health Policy, and we're getting substantial support for that. We started another organization called Business Leaders Transforming Healthcare. In California, we have 300 members, business members, for the Business Alliance for a Healthy California. We have other memberships, 200, 300 members across the United States. New York is starting an organization. Ohio is starting an organization. Yes, there is momentum.
Okay, let me jump to Jen Kimmick. Jen, you and your husband co-founded a brewery, Alchemist Brewery. You have about 50 some odd employees. What does this current healthcare system mean to you as a small, medium-sized business person? Hold the mic close to your mouth.
Yep. We provide health insurance to all 50 of our employees, full health insurance for employees, their children. We cover half for spouses. My husband and I do this for 3 reasons. The main reason is because we believe everyone should have access to quality health care. Simple. The second reason is it's just a plain good business decision. When our employees are healthy and when our employees' families are healthy, our business does better. Morale is up and productivity goes up. And the third reason, and this is really important, is we can afford it. And I say that because it took us 8 years of business before we were able to afford it. We spend $300,000 a year now on health insurance. And our employees don't have the best health insurance. We have what is considered a great plan. It's a silver plan, but the deductibles are high, the co-pays are high, and the out-of-pocket expenses are high. So we spend all of this money, and our employees still don't have the stability they need, and they still don't visit the doctor when they need to.
Jen, what would it mean to you running a business in a competitive industry if all of your employees had health care as a right and you could worry about making the best beer in the country rather than providing health care?
It would be great for our business because, again, our employees would go to the doctor and get the medicine they need and get the treatment they need. But it would also level the playing field for all businesses, especially small businesses. Vermont, like a lot of states in this country, are really small business states. 90% of the businesses in the state of Vermont have 20 or less employees.
And it seems to me you're trying to do the right thing from a moral perspective. But if you're competing against somebody who has a different point of view, am I mistaken that you're in an economic disadvantage?
Absolutely, absolutely. And it's harder to compete with recruitment and retainment. It would level the playing field for all businesses. And then I would also add that while there are a lot of employers that can't afford insurance, there are a lot that can and simply don't. And so when we're covering 50% of those spouses, we're covering bigger employers that just are not willing to change.
That's an interesting point. All right, our next guest needs no introduction to some people at least. Dr. Don Berwick was trained as a pediatrician and served in the Obama administration is the Director for Medicare and Medicaid Services, the head of CMS. Don, let me ask you, start off with a simple question. You ran Medicare, you ran Medicaid for the United States of America. My understanding is that the administrative costs for Medicare are somewhere between 1% and 2%. Administrative costs for private insurance vary 11 to 15, 18%. Why is Medicare so much more cost-effective than private insurance?
Because the only thing we're trying to do is stand up for the Medicare beneficiary. No billboards, no high salaries, the complexity of the system just isn't there. It's simple. I spent the bulk of my career, I'm a pediatrician, but most of my career has been spent trying to figure out ways to improve quality and lower cost in healthcare all over the world, not just the U.S. And what we got here is insane.
Is that a medical term?
We are, like you said, double the next most expensive country. Our life expectancy is 31st in the world. Our infant mortality is 38th in the world. We have an underperforming system at extremely high cost. And this, you've heard from the business side what that does to business. What it does on the public side, you know better than me, Senator, but in my state, Massachusetts, every line item in the state budget has gone down steadily in 2 decades. Parks and recreation's down 50%, education's down 20%, you name it. Law enforcement's down 20%.
Because we're pumping more and more money to escalating healthcare costs.
52% increase in healthcare costs in the same interval from 2000 to 2018. So this is confiscation. This is healthcare taking money from businesses that need it, labor that needs it, and public services that need it. And it's wrong. And
all right, let me ask you this. You ran Medicare for the Obama administration. Medicare is, in fact, the most popular health insurance program in the country. Is there any reason, in your judgment, why we should not expand Medicare, which now covers people 65 and older, to every man, woman, and child in this country?
No, there's no reason. It just will. Running Medicare, I didn't run Medicare for all. I ran Medicare for Medicare, but it's a privilege. You get to go to work in the morning. There are 50 million Medicare beneficiaries, 60 million or 70 million in Medicaid, and you figure out what they need, and it just makes sense. Well, we need transparency. We have transparency. You can find out the prices. You need prevention. We shifted money to prevention before and since the Affordable Care Act. You need chronic disease care. You need a nutrition program. Medicare can do it. When I got a report from the Inspector General saying that we're over-sedating people in nursing homes, the next day I was on the phone with the nursing homes and the geriatricians and said, you stop it or we'll stop it. You can stand up for people. Why wouldn't we do that for all Americans, not just people over 65?
Okay. Let's jump to a video question.
Hi, Senator Sanders. I'm Andy from Washington State. My question is, if Medicare for All were passed, would the tax increase be more or less than what I'm already paying out for my employer-sponsored plan?
Thank you very much, Andy, for that question. As a recipient of 30-second ads that raise that issue, let me respond. Here's what goes on. When you watch TV, what people will say, and I had this thrown at me all of the time during my presidential campaign, Sanders is trying to raise taxes. Well, it is true that many people, not all, will pay more in taxes. But if I told you today that instead of paying $10,000 a year or $15,000 a year for private insurance, you would have to pay $5,000 or $7,000 more for comprehensive health care for your whole family, what most Americans would say is, where can I sign up? So my Republican colleagues think it is somehow godly to be paying incredibly large amounts of money to insurance companies. That's good. That's wonderful. But somehow it is terrible to be paying somewhat more in taxes. Bottom line is that when we spend twice as much per capita on healthcare as any other nation, we could substantially lower the cost of healthcare in America, which drives down the cost per capita, which means that we are spending less. Right now, we have the absurd situation where in the last 5 years, in the last year, the largest 5 pharmaceutical companies in America made $50 billion in profit. $50 billion in profit at a time when millions of Americans cannot afford the health insurance that they desperately need and cannot afford the medicine that they need. So the issue is whether or not we join every other country on earth and talk about a national health care system, or we continue our dysfunctional system. Now, I shouldn't have ranted for that long, but let me throw it back to our distinguished panel. Richard?
Senator,
Hold that mic a little bit closer, please.
The United States is the only country in the industrialized world that relies on private, for-profit insurance companies to finance a substantial part of its healthcare system. We spend $1.1 trillion a year in this country for private insurance. $200 billion of that goes for administration, sales and marketing expense, and overhead and profit. If that money were devoted to Medicare, it would be in the $20 to $30 billion incrementally. It's an absurdity, and the reason we do it is because the insurance companies and the pharmaceutical companies spend enormous amounts of money on lobbying Congress, on public relations campaigns, on corrupting our media so that we don't get the information that we really need to make an intelligent decision as a population.
Don, did you want to add something to what Richard said?
Well, I just think about the future we could have if we really could organize care on behalf of people and communities, really move the money around to where it's really needed, really be transparent about prices and about where the money's flowing, and be accountable. We could have a better system. I think it would cost less. I think it would cost substantially less. But even if it cost the same, which I don't think it would perform better. We'd finally have a system that's responsive. Medicare, you can find out what's going on. You can't find out what's going on in this incredibly complex system that's built for opacity. This is an accountability issue to me, which is if we have Medicare for all, finally the system would work for the people. And it demands transparency. Would it be simple? No. Lots of problems to solve, but we're solving them in daylight. And that's what intrigues me about the possibility here.
Let me pick up on a point. That Richard just made. Because really what we're talking about is not primarily a healthcare issue. It is a political issue. That's really what it is. Since 1998, in the last 20 years, the pharmaceutical industry alone has spent over $3.6 billion in lobbying, not to mention hundreds of millions of dollars in campaign contributions. They have an endless amount of money, and they use that money to maintain a system which uniquely in the world allows them to raise prices anytime they want, to any level they want. They have been able to keep Medicare from negotiating prices with the drug companies. We're the only major country that does not sit down and negotiate prices. Veterans Administration does, but in general, we don't. Medicare does not. We are not allowed to re-import into this country lower cost priced prescription drugs from Canada or other countries, and we pay by far the highest prices in the world for our medicine. So I think when you look at the crisis that we're facing, it is not a debate over healthcare. It is very difficult to defend a system in which 30 million people have zero health insurance, even more are underinsured. Our healthcare outcomes are not particularly good, our life expectancy not particularly high, and for all of that we spend twice as much as any other country. Hard to defend that. But what goes on here is lobbyists all over this place, campaign contributions in the hundreds of millions of dollars, which takes us to the issue of campaign finance reform, et cetera, et cetera. But, okay, I think we've got a question right here from the audience.
Very quickly, I want to give some context for the people here in the audience and also the people watching on the live stream. The video questions that you're seeing were sourced from Facebook, Twitter, YouTube comments. We got hundreds of comments of people wanting to ask all of you and the senator questions, which just shows the level of public interest in this topic. And we also have another great question from our audience here. Michael Mashad has a question for you all.
Thank you, Senator Sanders and the panel. Senator Sanders, I want to say that your advocacy for the middle class is the only reason I find myself in Washington, D.C. today and able to ask you this question.
Thank you very much.
So I've worked for several corporate employers over the course of my adult life, and I found that they prefer hiring part-time employees rather than taking on full-time workers. Where there was one full-time position, they'll staff maybe one part-time, maybe two if you're lucky, and they'll schedule the part-timers, including myself, right up to that full-time threshold within a half an hour of it, just so that they can avoid providing full medical coverage. Because of this, I went 10 years without access to affordable health care until the Affordable Care Act. That was the first health care I have known as an adult. So my question is, what can be done to address this kind of exploitation of workers by employers who could easily afford extending coverage, especially in states where healthcare exchanges offer very few choices, like my home state of Arizona? Thank you.
Thank you, Michael. Thank you. Great question. Look, thank you for that question, Michael. A simple issue, very simple issue. It's a moral issue, it's an economic issue, it's a political issue. Do we believe as a people that health care is a right or is it a privilege? I believe that it is a right for every man, woman, and child in this country. And so do most of the American people. But because of the dysfunctional system that we have, we run into absurd situations like you described, Michael. And let me give you an example of how crazy, or to quote Don over here, how insane this situation is. You got a company like Walmart. Walmart is owned by the Walton family, which is the wealthiest family in our country. They're the wealthiest family in America. But they pay wages that are so low that many of their employees end up on Medicaid, which you pay for. So on behalf of the Walton family, I want to thank the working families of this country for subsidizing them. They're very grateful to you. But the point is, that's one situation. You described another situation, and that is people working part-time so that the employer can avoid providing the benefits that that employee would otherwise be entitled to. How crazy is that? So what we have ultimately got to do, it seems to me, is two very simple things. Number one, as a nation, do we say that we join every other major country on earth in recognizing that whether you work full-time or part-time, whether you're a single mom, whether you're 90 years of age, health care is a right, not a privilege. And once you make that determination, then the next question, which we're discussing now, is what is the most cost-effective way to do it? And I think all of the evidence suggests that a Medicare for all single-payer system is that way. Now, what we have going in America today is we have, if you like, an example of what a good system is. We don't have to invent Medicare, we have it. And as I mentioned earlier, it is a popular, effective program. Unfortunately, it only is applicable to people 65 or older. So the simple answer is, Michael, that whether you work part-time or whatever, Medicare should be available to all of us. And the legislation that I've introduced, along with 16 co-sponsors here in the Senate, would do just that. All right, let me throw it out to the panel. Michael raises the absurdity of employers intentionally finding ways to avoid providing health care. Who wants to comment on that?
Well, the system is full of incentives that really don't make sense. We have employees at MCS that are 50, 60 years old, and the insurance companies are asking us every year at renewal time, well, you have an aging workforce. What are you doing about it? Well,
are they suggesting you should fire your older workers?
They're not, but the incentive is for us to move our older workers out through bonuses, through various ways of retirement, which becomes very expensive, and also it is a waste of human capital.
I mean, what a gross injustice. Somebody is working well at 60. Why shouldn't that person continue to work?
Here's another incentive. The insurance companies make more money as healthcare costs rise. At the same time, they're supposed to be representing us, Senator, in negotiating reimbursement rates effectively for our benefit. That's a serious conflict of interest, and we know that we call it crony capitalism. We know that there are deals being cut throughout the system between insurers and hospitals. Okay, you raise your price a little bit here, you cover me over there, and the ratepayers will pay. That's the way this system is working.
Jen, what's your experience?
Well, we experience the same thing. As I said before, we have several employees whose spouses don't get insurance from their employers, and we need everyone in the pool. We need everyone to pitch in. Everyone needs health care. But I just want to say, we don't just want our employees to have health care. We want and we need everyone in this country to have health care if we are going to seriously have economic progress in this country. Without it, it's just not possible.
Don, if you could jump in and respond, but also we haven't gotten very far into the question of international competitiveness. So if you're an American company competing against the company in Canada, company in Europe, and their healthcare costs are all covered by the government, aren't we at a disadvantage? Aren't our companies at a disadvantage? Richard, Don, Jen?
Well, certainly, Warren Buffett, one of our most profound and successful business leaders, has reflected on this. And his statement several months ago at a Berkshire Hathaway meeting was very profound. He said that health care is the tapeworm in the belly of American competitiveness. And it's true. It's very true. If we're spending $10,000 a person, and another country is spending $5,000 a person, we're at a serious disadvantage. We're going in the wrong direction.
Right. Don?
Well, first, the same's true on the public side. It hurts American public integrity, the ability to invest in housing and transport and the things that make us the country we want to be compared to other countries if the money's all going over to healthcare. I just want to comment on Mr. Michaud's story. You know, all I could reflect on when I was the head of Medicare, I went all over the country visiting, you know, centers for the aging and populations of Medicare beneficiaries. The one question that was never in the room, never, was, do I have coverage? They do. They know it. We walk in and the platform's completely different. We could do that for everybody. And the behaviors of the insurance companies and the drug companies and all, look, they're playing the game according to the way the rules are written now. And as we don't change the rules, we're going to get the same game. We have to change the rules. Medicare for all is a fundamental change in the social contract of America, and it would change behaviors because it would be the new rules.
Let me toss out a question, and tell me what you think about this. My guess is there are millions of American workers who are currently at jobs that they don't particularly enjoy because they get decent health care. I remember some years ago, there was an article in the paper about some guy in his 50s who had been in the military, went back into the military, and somebody said, why are you going into the military at the age of 55 or whatever it was? And he said, well, my wife has breast cancer, and that's the only way that I can get treatment for her. How many people do you think are at jobs they really are not happy with, but have decent insurance? What would it mean for the economy if people could say, you know what, I don't have to stay at this job. I can go someplace else. I could start a small business, and I'm going to have good quality health care. Is that a factor that we should be thinking about?
Absolutely. Yeah. Small business is the economic engine of our communities. We know that. And if small businesses aren't able to go out and start up because they can't compete with recruitment and retainment, or young entrepreneurs aren't inspired to go out and start their business because of lack of health care, we're really not doing the best we can. We really need health care to move our economy forward.
Right. Don?
The other thing to remember is the only source of the money is labor. I mean, whether it goes through taxes or the employer's contribution or the out-of-pocket expenditures, it's always coming from the worker. Everything is coming from the worker. So when we say these costs are high, we mean American public, American worker, you deserve to get more money. You deserve to have the money in your pocket or better used.
You know, Senator, we haven't discussed the phenomenon of flat wages. You've just talked about job lock. Flat wages, if you look at $13.50 an hour, and if that's going up 10% a year, that's, for that employee, it's $1.30 next year more than it is this year. If his premium share is 25% or 20%, as it is in most cases, his cost of living increase is not going to cover the increase in premium.
Right.
And that means flat wages or even negative wages, while the employer is experiencing a 5 to 7% increase in labor cost. This is economically unsustainable. We have got to do something about it.
Well, I think what we have got to do about it is to start thinking big, not small. And just ask yourself, this is not a radical idea. The point I want to make over and over and over again, what we are talking about exists in virtually every major country on earth. Think about a nation where you could start a small business and not worry about having to provide health insurance to your workers. Think about a young person who has a dream of what kind of business you want to start, and you don't have to worry about whether or not your family is going to have health insurance. This is not a radical idea. It exists all over the country. And it's time for us to get off the dime here and move forward and join other countries for a Medicare for all single-payer system. So, panel, thank you very much. Great job.